orang ba maratra health was yung maldim lebud dim nakakura magplol talmal malumong kora uldig lang o sisit time at tulig kada gira daldi orang asaw la ngasulela bubak le kada albang belul adro gira albang ra pandemic ra covid-19 e kita sabe edel senkyo kada mora balot pak sa mga exercises sa gidil lamalte del senkyo ra mo besel mutaling irgid makadamal ti orang asaw gidil say
I see.
Tulig mal ngila panel al kapsangay di ko introduce ti de kita mo follow sa gidil lo sisul format na talk show with muna kada introduction nekti mo umaskita ako di kitable educational segment ungingil say ako ra katibal update sa to ko audio since sa last talk show last week
I see.
and then ngatyang special guest division of behavioral health once again ako bring sulel Dr. Constantine Dr. Bing de la Cruz ma Director Ribka Kintaro ma Kendall Titiml tira other division of behavioral health and also ilme multilo bangeda al gasus til multilo kora olga ser gidro ko tulig akum das ngesel mo gidro ko including kamamar other hospital mar rest frontliners malungil lulaklat kamakora tips dealing with stress and mental health issues landang sila pandemic ya mo ulabong le tuliga imal bilang mam mo introduce sa tara toktang ngiyam la mo sabel me bong kamamar tel EOC ra ministry ra health nga Dr. Yano towards the end of the program kada introduce ngil vessel public health advisor or analyst ra ministry of health EOC
Okay.
mam recruiter ngi magiman maling asulel mga gidil pagpanggeda ra kasus mga teal sa el kora di ngil introduce ngi not that he needs it but kora of the swell gidil tel studio del bangi
I see.
Again tuli ka dito reminder our listeners was sa gidil educational segment ya boluriw ra talk show and sabi ilom ko dongon may ngel kotel adel el correcta en seringi ang ani sa gidil for a price sa ilmo
I see.
Sige da mo tetele la talk show kita Jesus again ang ngani questions sa ra da malugong comments sa ilom ko dongon mora look the text and morsel deng wara PIO 775-1138 malubel online lo banggedra tegidil Facebook page ra Diaz Broadcasting and they're welcome to comment ka sa email share maging atyang itulig el panel lo mangela retail as always retail udo incident commander maadon brigadier PIO sige itulig awara ta kora updates kora di mo smoothie tegidil new normal
Okay.
yang kado kora di orang seringira TV ma social media ma adra blo direct dim sa adra new normal matiang man ngaran new normal besel teletal besel lograd besel lulat langara alsel albang tiel pandemic na COVID-19 kada matingel was avec el sil sa alsel aklangar gi dengan yegel dongot bok ra to ra bior ma to ra klad ma to ra sku el ngi am la mongod ra blul adrogi including rigider belaul even though dirga ka madang al adl was sing sme tel rak tindi gi tel mo bes avec patigela affected tel pandemic ra abulwat ngani ga gi preventive measures so masin dringia preventive measures blul adrogi including rigider am la mo o start el mogatmok el masabak rigid el tagid el rak tel COVID-19 Muntoko era hand washing, muntoko era mask o mask, muntoko era physical distancing, adapora igal karos nga diagel bebira establishment sa bela for example abang ko Hawaii may gal bebira bang katapong ingida dalo mask do ora line roidra taraa de gida dal dimalbal sanitize imat madapora igal bekkel stawang ma pagkaroos sa shopay, gadum lang mo sa igay gitan war plexiglass, niya barriers, el mga sadar sa igay telel tiar armel ngalrak tel mo yulat, aadon mo nataraat. Tuli ka matoko na laktaw na ma-close sa borders, ma-digyas kogi, tiya dia new normal. Mang datalgibel ngatangat tara bel ngal sel belaw ling hindi ka podol eswar sel mal ringilel tiatoko ilandiri kalbon ngarak tara atsala bulwat makadoko adi mosu iringi ray gay gidil laktung ra stawa nga mabang ka magel de borngi hindi la ka bodo armi sa gidil full effect ra a new normal and mo include a lockdown ma restriction na movement Pongarad toko maran mo niya community transmission al sa labulwad ang maagila del implement ay gay gidil full preventive measures including our lockdown ma restriction or movement rara isa gidi ako tas ng maral tael del new normal mang tas gi melokor teng tulig ilang whether we like it or not the risk ang arngi anytime in ceremony agay sa rabulwad gira del diklakar gira letiang asabel chance gitan na mesa kwamel mablura marigel notel albuil kura maran modio ay diselagay sa mutubok kwamle is up for restrictions ma lockdown preventive measures and Google Meet spike cases milatigagi den balmon mga regigi
okay never mind
take the new normal mangira del understand lo sega patokora back and forth the on situation andangara alsel mong segi di ako educational segment lo si take the new normal lagi del di kergi kelgire le mok kergi del gire lo ba selulta selwa se tan diri kalbon niya raktra sala bulwat hindi gire del di katmok kelgire sa gire time ya kanam so is percent maral tingilel malubong talang tingil tagi del new normal mong segi di ako educational segment tulik tagibim lokamang tandi undas palso mamel lukura makatakli lo sa tiyang mal ngarabal gole oda dio rex ngira TV man news ma social media kada ira dal kura man mongil understanding to kuni de lan diri ka tasis para sila situation na mo niya guys sa balba dilbor sa gid tulik ka kulingit tra reader mo kura maskita update tra tetela la rele tra tanaw mo ka sunday man mo
okay thank you
Welcome sa nga tulik. Oo, ito LL sales yung nga niya 53 nga quarantine. Kadamla matagil wasing to kasi lara sel flight ra tayo ang may sigil sa nga 14 ay sigil le hotel group pra soldal mle 14 tirigem tanga tiyan nga sila quarantine nga mandatory quarantine tirigel direct pag di compare sila Monday ko tulurior el 7 direct pag military direct pag po tirigel sila nga rin tirigel 8 K9 tirigel direct kada direct luluay sa tirigel 8 terbili sa malmol nga tidak tengah quarantine dan di tengah kiat tengah sisi action team camp so itu sisi camp narinya ada yang safe friend untuk omitir tim makmul to betirgal alngara ida di quarantine ada tidak kalau ada distrigal tool ada dan lara nakurit pingal me dirigel dari malmol tengah quarantine dirigel lara Taiwan alme tester tira de isem na morir ang klubo pagtubog sa negative rogoy esta tuwag na ongin mo ng murang klub nga sa gila mo malmol na sila self-monitoring place na mo sa Mudi wasit sila since sa Taiwan low risk itigil agadan ng arsel meya other reduced quarantine mo dahil sa gilid full mandatory 14 days mo 7 days so these are the top then gilid direct kung din monitor themselves for 7 more days and the last the kira day 14
more safe
pag direct pag lahat via nito was tigil 14 and day ang soldado mo direct kal lobre first tool test tirigel 7 namlera Monday test tirigel gidal dirang kal tilo sa tester still negative dal mutal test ra day 7 ma day 14
I see
so ay dia ko ra update ra quarantine ma test ang nila kita ko upload sil so at ito kada mo dire kalmo osmodi ako ra situation ra kwam mang el time hindi la halto ga es Ribka ay Israel al sil ra kwam le sala din ma Maria gigi the reporter tit unding tilo ga selbu kumle reporter eli wasi ngariya terul adara ladara eli al sila kwam larinya Tingagi the teru ngele one namle 65-year-old male inga mle no COVID case le mlara sele kwa regional medical city it's a transferring in mora GMH tingagi the mlara elira 1:08 p.m. number 6 fatality related and mora COVID rakwam Kelguklo bang number 37 ng amlagra 2:18 p.m. So, 1 hour at the long list tingal terus patients. Engge amle 52-year-old female at dina kalmlani underlying health conditions ringi. Admitted al Morakwa Memorial Hospital September 5. It's a test ringi upon admission and test positive SARS-CoV. Nagigida ang lomang number 37 na fatality ra ablura kwa ilan na nagbiyak lagi sa kwa mula mo 2,190 istegi del veri alone in 43 RS case ilan yung bilga malmol mga 15 na gate to tinga ICU at one time ilan din kurak malilas ano 19 tige capacity tira ICU 17 tira no 19 no o searchum lo beyond their segi de elat na mo 15 na nga ICU.
Okay.
Oh, so segi de agora this snapshot ra situation ra pamrelangi.
Okay. Hindi ang come to repeat again numbers 37 is off today namo 37 tirgen nama the terrak to I say.
I say 37 na nama ra kwamre
Okay, yeah, rather el smear positive at 2,190.
Oy 2,190 amla mo positive ra akwam eso ja es of 7 p.m. ra asus ra kwam I say.
Okay. Sulara information. Okay, kadolmon.
Tuloy ka agad direct tulbes kung natin nakatele ng smoothie since last talk show lagay tabloid first release tilog lagay lagay one العادة المدار أمرا تيلوم دبيلاو مدار سلبلول بلورني تيست positive.
I see.
من سيجي يا ملوت التلال من سلم لقط التيست اليلور الغراب بلول بلورني أملك positive ماجي لوريو لبنتريرا أقوم بالي يا employer نير بيلاو ما direct سل international health regulations officer WHO ما سيجي البلو ملوت سبير لون سيرجي من لون أونغي رول تيست لون مو أملا نيجاتيف.
Okay.
يجي الترافلر أملو تيلو درافورن تور سيجي النيجاتيف سلونغي رول نيجاتيف تيست ريزالت. تيجي سيجي IHR أوبيس الورا أول لون تملمون مراوديو لون سيرجي الورا ملاس ملومس سينغانيا الورا موت talang tingil tial toko gira del moment ang hindi so far ngora general assumption I was saying sel test positive am le false positive so hindi bla sige del sales lagi move tial ay sel wasing ani tiagil situation gimlo sa mamal mga contact tracing igita tuli kam nas modi contact tracing ra talk show magunda sa mallotak la at the telelawir contact tracing mula sa mga isigi di test tirigel el mildang alwasit close contact ng gagi del adan nor amrain
I see.
So we had test the sigi del time sigi del seals tilo da a result tiro hul negative mo katokora at meron ngudul gidel say le mal wala dim lebre the telelawir mo so the dimension ngi ingay sa adra bulu ako adil ka raw ndil gidel say mong ilan time mong wal sa edel mula sa sige din le got test am le false positive.
Okay. So in other words, sir, the same false positive lang mle different clinic malubong laboratory amle test into the positive alubong sisul company.
Yang saya kita tuling malungil kayo mong selong erul test giblem request lo selbol murang modal hospital malubong modal lab. Mong la sabel makatmok why say kita long erul lab ngil tablo lab ay certified ra say kita government sel belum sel ministry malubong department of health.
Okay.
Okay.
Malungil mang namo di ada begitu.
Ya ada begitu tinggi ada begitu.
Okay. Wasi. Okay, nakadalo mo.
Okay, maka magtataya lang muna ada behavioral health. Maybe Dr. Bing, you can start off.
Okay.
With some of the topics you want to share with us this evening. We thank you, the three of you, for joining us again.
It has been brought to our attention that recent weeks there were accidents that were related to intoxication with alcohol, and so we are just reminding everyone that we have a program to deal with substance abuse treatment, and I have here our one who is in charge of the Community Guidance Center, Ribka, Kintaro. And would you like to tell them what programs we have with the Community Guidance Center?
For our programs at the Community Guidance Center, we have the drug and alcohol outpatient treatment. We have counseling for addiction. We have life skills for teens, most especially high-risk teenagers. And we have anger management and stress management. Those are just some of the few programs that we have. We do jail services, and we deal a lot with domestic violence and other charges, aggravated assault and anger issues that come from the court. And anytime the community requests, we go out and we do educational outreach to schools, hamlets, states, depending on the request by the community or the schools or the organization. It's usually with us, or we can work with the doctor and other counselors and other programs in the Division of Behavioral Health.
Yeah.
Well, of course, these substance use disorders are related also to some of the problems that might be occurring at the moment, like the pandemic crisis, or some problems within the family. And if there are people out there who are overwhelmed about their problems and are suffering from depressive and anxiety symptoms, then they could also go to our clinic at the Behavioral Health Outpatient Department and have a consult or counseling with us, psychiatrists and our social workers. We also have spiritual health counselor, and also the psychosocial rehabilitation office. And right now we're having also those peer-to-peer groups wherein fellow patients are able to share their experiences with fellow patients, and they have their weekly gathering, and they come up with activities to make them busy and be productive.
Okay.
I want to mention about the other CBD. I think we started the discussion last time you were here, but no, it's an open discussion. So.
Okay, cannabidiol. Well, in terms of FDA approval, there's only 3 approved uses of, well, 2 for cannabidiol, the seizure disorders, just thought Lennox, and the Dravet syndrome. Those are the 2 seizure disorders that are that can use cannabidiol as a treatment. And then there's the synthetic THC, tetrahydrocannabinol, wherein it is used for patients who have cancer and are having vomiting issues and who lack appetite. Okay.
What is the difference when you're intoxicated with alcohol and then if you're intoxicated with marijuana and driving? I know there's always a message about don't drink and drive, but what about other use of other substances and then operating a vehicle?
Well, yes, alcohol in itself is already, it's a depressant, so you might feel euphoric at first because of this inhibition that you get from it, but later on the depressant effect comes in, and so it can slow down the reflexes, so the reaction time, especially when you're driving, is delayed. And if you also use other drugs, then that can also affect your reaction time further, slowing it down. Like marijuana, which is can also depress the reflexes.
And I know that a lot of, or most of the programs we have at the division are geared towards helping individuals, but is there any program that sort of targets family members, parents who know that someone they love is probably a user or addicted, or and what are the tools or the things that they can do to help the person in need instead of waiting for them to voluntarily decide that they need to come in for service or for assistance?
Well, there are instances wherein it is the family members who go to the clinic and ask for our help, but of course it depends upon how the patient or their relative is on the amount of use, maybe. If it is already affecting the relationship and it is already leading to problems with breaking the law, then the police may be called to bring in the patient, or if they're causing violence and being agitated, then they can be admitted, or if they're harming themselves. Okay, so those are indications for admission. Our limitation only is that we have a small unit, so we can only take so much. And at the moment, with the cases rising along with this pandemic also, we can only take in 10 patients at a time at the most. And so there are other patients who have to be admitted at the medical ward or surgical ward if there are if there are vacancies. But and then there are also those that have to be sent home because have any space for them, but we do advise the family on how to go about it and take care of their relatives. And while there are those who come to our clinic and ask for help, so we also instruct them on how to deal with the patient in order for them to be able to bring them to the outpatient clinic for a consult if they're not that restless or agitated. And of course, when we have patients who are about to be discharged, we also...
And of course, along the way of educating and getting to know these families, we find that they also need the support. And so part of the education, and some are a little bit more hesitant or more in denial, and most are very appreciative, and then they do tend to kind of follow up and also get help on their own.
Yeah, it's I ask because most of these cases with the crashes and involves injuries and fatalities, they can be avoided, but we usually take the initiative until it's too late, right, and then you regret. So we want to promote that at least if they don't want to bring a loved one in, at least they know how to identify the signs of the problem, and then have some sort of guidance on how they can start talking to them and trying to help them if they don't want to come in for us to help them. So, it's just a discussion that we want to start because we know with the limited flights and we don't know when the next one is.
Right.
Without specialists on island and equipment, that's our number one concern, is making sure that we prevent things before it's too late. And unfortunately, we've had too many in the past couple of months.
There is data. I'm sorry, but I can't provide the most up-to-date one. But there is a correlation with election year and the rise in alcohol use and all these accidents and injuries, alcohol-associated injuries. So just to remind everyone to please be mindful, be extra cautious. It is this time, and into October, November, and December, this is where we see a high rise in these accidents happening. Maybe another time, then we can come and give more solid data and more up-to-date. But we do have numbers, and it's something that, yes, it shouldn't be too high a number to talk about it.
So again, in case anybody listening wants to come in or just have a chance to ask general information, what are the contact numbers in contact you guys?
The BH Outpatient Clinic, it is 488-1907 for Community Guidance Center.
488-4711, and Prevention Unit 488-8118.
So here's pretty much the questions along the same line, like how can we tell that either you or somebody else has a drinking problem? What are the steps that we can take to approach family members or friends who might have a problem and need help?
Okay, well, among the signs that make you suspect that a person is abusing substance is in particularly alcohol. If they're consuming more than what they're capable of course we all have our own tolerance to alcohol. But if they are consuming more and for a longer period of time, okay, and they are spending a lot of time getting that substance, alcohol, and if they are manifesting with like odd behavior, like already stealing to buy the substance, or if they are being restless and displaying also with there are withdrawal symptoms that we can see in these individuals who are abusing the substance. There are the hand tremors, okay, a lot of sweating, especially when they cease to drink the alcohol, and when these persons are intoxicated, they might also have changes in behavior. So this is due to the disinhibition. But then there are those also who may become violent when they are intoxicated, and of course we should watch out for those who are experiencing blackouts, and because that's not a good sign. Okay? That's a very bad sign for someone who's abusing alcohol. And if they are manifesting with those withdrawal symptoms especially, then it is best that you as a family unit try to intervene, of course, with a non-judgmental attitude, and try to talk to that individual into seeking professional help and probable detoxification here in our hospital.
Okay.
Thank you, Dr. Wing. And, it's ironic that in Palawan we say Mlamusyuwang, it's become a social and social norm that with elections and parties there always has to be alcohol and drug use. So of course it's hard, trying to address it at the individual level as well as the society level and community level, and in that cultural lens. So again, I guess we just try to appeal to everyone that we all have our part to do, and including the candidates themselves. It's an appeal that as much as and whenever possible, promote drug-free, alcohol-free events, especially now during this pandemic when we know that medical referral is really hard to get for people.
Kafar, you mentioned something about the alcohol being served in this town hall meeting, and the question is, alcohol consumption increased in like how many percent compared to like before the election campaign start? A lot of people, just for two nights ago or 2 days ago, there was an accident in front of Quick Mark at Topside, and 3 people got hurt. I mean, they got hurt really bad. The question is, Mr. Bing, Dr. Bing, that alcohol-related injury, are they going up or still the same or going down or what? And we have to be aware that a lot of people, all of a sudden, they have money, that 19 million that was given to us and then dispersed to people that never had that much money, and all of a sudden they have that money to spend on alcohol. Now, all accidents coming to hospital, are they alcohol related or what? Is it a problem right now?
Well, I can only tell you about the recent accidents that happened. Maybe about 4 of them I know were alcohol related, based on what the ER doctors were saying.
Right.
Like they smell of, they have alcohol breath, those who came in, so they were assumed to be intoxicated with alcohol. At least 4 of those accidents, but the others I'm not aware of.
Yeah.
Yeah. But from what they're saying, there's been an increase.
There has been increase?
Yeah.
Oh,
related
okay.
to alcohol.
Right. هذا كفر سلدو مسا يجلو دود أربوي كريلا all of a sudden بكلو دود على لابت مستقل ملي مرهم. What Omdasul was saying, maybe I say the Lunga dود المرترع سلا بلور بلا تبتوكل بكريل هذا موريا ودودير مت ماي مارا رومي. هذا بس قرام لا increase like alcohol related incidents. So agree dengan malu bendiam.
Wajil dulu Ribka lasa mambo mesa adairan ding maral ko lasa baed lo mesa lo seseloran muktoka gayid el kaldib ma ondib el togora campaign ma togora sports mga rappel most likely correlate lo bangela accidental. Wala tito sa accidental sa prevent. Yeah, so say gida adon lumkat kasi last talk show lo umasa igel top reasons for admission will mar ana mo niwing number 3 am le injuries.
I see.
So talak ko sa upload lo ura gida injuries sa alcohol related.
Oh, okay. I'm only assuming because I saw that accidents at Topside, it was really bad. The car, one car was flipped over, and the people that were in there, they got hurt bad. Mergoya, aku meset tirga obaila igal bili tirgal kohosya. O temla amlara igal gid tan hon miring marubeng rally mergoya makal mebdula Topside mergoya accident flip over flip tian line miltabalar adam la sen. Mang maybe we can say kada mo careful like togora campaign marar el madirek kada el tela October 1st celebration of independence da belau may gari lang togora activities sa murtel lastate melmod dula Sunday ngari boat race la Sunday during that time is a lot of toklada opari emili celebrated the Independence Day. Di medal kita sa bodo kilmala laka atal batmal.
Sige tuloy ko man sulang tilay dia madoli tengira beklad lo se bodo kargi kleda kay gise bodo ka plat ka. Gay indirect effect ra pandemic ra adamo stress mo anxious so egel dilong doctor bing mo ko mo ma hospital la kar ma rom Lobang gila ito na secure, ito na independence sa holidays sa maraming.
Madrid ka pandemic so idol ngarian adal malmo stressed out and solay moria problems sila dalang clear malmo relationship instead of coming to see Dr. Bing or hospital they take their own alcohol. They turn to alcohol, they use alcohol to solve their problem. And I think that's not the best way. The best way is to talk to behavioral health or somebody at the hospital that can help them instead take your problem and then use alcohol to solve your problem. That's a wrong way to do it.
Sulang tulig. Thank you, Dr. Bing, Ribka. Kada Kendall tulig mo selbodong simring mo yawadi itakla tara alitak.
Okay.
Ilang yabay da baik mugtalta like introduce ra Dr. Yano.
Okay.
Idrogul di menangla Dr. Yano tara pioneer tokoira guru ra selbelaw. Magiman breng asulan garubak ling gilngen me panggamam enggang tulig initiative sa CDC Foundation. Ilangan niya US CDC Centers for Disease Control Prevention at yang akuk walgorak paglamel sa igidil government agency non-profit lawrio labang gila CDC so ang CDC Foundation nga niya daw ngaringi lon nga siya igalbek US API igal US affiliated Pacific Islands include ra FSM Marshall Guam Saipan American Samoa nga niya kakro sa lawrio sa biid lon nga siya igidil higher raat including raat nga raat sila abelaw fulfill legal roles magi magtangat telem los bela Dr. Yano gongin me nung sir gidra awrele dra minister ako tokora public health analysis mga walwara o bangged the public health advisor mag introduce ringi sulel al kilngil sa elme bangged maro ko sa tear mal ko kanya sulit mo.
Okay.
Sulang Mr. Diaz, sular at al umul mereka sulir adra at yale EOC recommend aktiva ulungit mubam apply at yalo real para di netlok le mereka mo at yal website masang odruk liangak lumong tiadim lamre del morning interview ngerul interview imo agora dulger kau gamral mle apply makmo oy pero kumade mutiadi short term makmo direct lam ngei oy to gerok mung kumade mung motelaw dudel ma mulwa se dia mada ngei mung to gerok mung ra amount saman oy salary ko makmundia ngei ding dia selalu spare tok ludo.
Okay.
Mentok mo overall mentalal hindi ngil mak mutila karak mal betok.
Oy.
Mangra minimum mak mula sa sergot minimum rugumi sa igivya. Bakol next week at interview labangkel kan hire. Ka reveal talk tang magi adol mamrege gi dimla ka malgin mosab igerok mung raul mung karasa mung ra qualification ra kauma mo total guru ra hel dimla amla mo ko ra
aki ka overqualified
ma mla se maklu ke bom saing ay kal babier di ka ulisul betok Ay ka Louis del Baviera gira tulmungoy, ay ka Baviera San Francisco,
Oh,
New York. Mergo girel saying ngaka saying ito notarize.
oh,
Durok kulmong. Lang almutul nga niya Baviera makmu ritet kaya bukara man merenglal. Hire mal to ka process ngi.
MOH sa tuloy wala tinggal na ling redirigir kali. Kenpet?
Dia nge
Yan na interview kan belasting veteran.
Natalie Jones. Nge Toktara Arm. Toktara Air Force.
I see.
Siabal. Mdul dive mong soal amelding rigid.
I see. I see.
Oh, siya taring in May.
Ikaw para bla retire mag-arti lang.
Yeah. Oh, nagtiya part-time tulig.
Oh, okay, okay.
Oh, mga aktyal kale retire ak bumedo meeting mak sa bedel dio Zoom tingar office nga. Okay, parang nga three comments. First of all, Dr. Bing, Ada ako magingit mong ngariya AA diyal belaw. We have AA. It's
Where?
At PCC.
First time I heard about that.
Ngariya AA. Diyal AA ablet start ringa Bill Pericles.
Oh.
Ngobal ra Sel Utro Hospital me Sera Lorael.
Oh.
Priu lang los mer mong miloid.
Oh, I see.
And then ngariya foundational. Doon ba mas kumama top kurang esul girel Palau Health Foundation their foundation a sponsor pasyo ngara PCC 3 times a week langarnya meeting itir with the clock
Okay.
stay open al mora ngidil adil soril mora AA no matter what they say proven
Oh.
Lugru rarad los peanes ratogara alcohol.
Abuse. Okay.
Sige na ako tul comment. Ang error comment tuli ka nuluate. Ali the will found the will NGO.
Oh.
Lulmo ringi ang kale Joe reclaim ab ira rumi namotrui irragal tel pool December tomorrow rail. Please don't drink and drive.
I see.
Number 3 Iraq. Michael data agimul mes tulik. Sel segi the 3 Iraq in Michael injury related to alcohol amiran migegogil merio. Ding elal temela sekyon de agungay. Amang akla mulngitra rumit mu parak kulara lemlutun balitial campaign raw era December.
I see.
Yung masertial tokoy mendakal para engalak regel sebedlo. And number 3 tokoy regulation HCF adolmen le HCF atilog da regulation ri mu insurance available pay raw rule ngia illegal.
Meaning what?
Bulak mo at subo mo you're drinking and driving. Tila at subo mo mol to plus hindi ako kumle tela lo magal matamal insurance at ako gira per sa lugro rugara of island.
Oh.
Eka far. Hindi ako lo ngir at dik mo dingit mong ngaringi. Agingilu loya.
Oh.
Amang akti malolngit na se alcohol sebedel blim rablit hindi ako molim mo makal mugul ralla mugul ralla gatomli matamal giram referral hindi ako giram peli
Men family malu bengal adal mit tamal la ber say the cost.
Why say?
Okay.
Dagim sal para all tao tactile regulation na dahil saan magiging dit magiging ilulo yang.
I see.
Hindi plus mo mem lang morur tiyak togol sum kumatamal ng digaw.
I see.
Hindi ako po morur at talamal expect travelur belan mo pagmaser ka ratan le.
من ديك مي كلية رأي يمرتقل وسائل information أنا خم نبغى لي أبيل السيرة ستات التاجد ال AA مو سمير سولا إغورا ملاد سيجد التايم من مير الآن يقول ملادولي so we provide us a contact person for that ما تنوارني the guy who sell advertising in TV for free my radio
Direct mo taxi nila korgal and daktil yang clean mga AA mo dakil sa dalaw ay sang clean.
Okay.
Dito ka Monday, Wednesday, Friday, till 7 o'clock mo 8.
Okay.
Ang hariya basyo tir. Yakmal di tir. Agi di mistiri ragi sa mga basyo. Itil low meeting like el temis.
Okay. May mga information mas pwede contact the tiragim liya or advertisement talo say. If you are experiencing these symptoms, and you can call AA or say AAA, AA. AA. I don't know what AAA. Amerika lang ang AAA insurance mga kurang may mixed up.
Tapos na mo roadside assistance.
Okay.
Adi last tulig adi se kamentral girela kafar tial new normal.
Oh.
Kada ngat le new normal rebelaw ngari gigil tletay lorura wabang di last week kum lora masil belaw kum denget mun dia kan new normal masil belaw ulung meeting diwal dia lo sisiu tegi dia tang al domestic al sugu mundu bitar ser gigil tletay la girad al momes
I see.
Ongerung kamaldil sera sarudem laringa kamaldil ablumam roikul
I see.
masirgaw pong mas diak
Sit so am.
Imedam hamle mong manom saura utorgaw
Okay, bam sula. Oy.
ay gigil kamaldil ay gem direct level tirak larwa social distancing ka farm giriu londa suk may gagomom karang.
Oh, I see. Oh, let's say second mlarngir o igul center algong palle ulisim second.
Oh, imral se ya last tokara iglesia le ado vela sorin mo iglesia
Kayu gele ado.
the bongit nila tokarang ya iroi daigal gingal motul gibel aroi dan di pumesang buklan mutun mo kayo ge ma social distancing iglesia dalo rurini ay ke kafara girin ngara duswiu le sugum do tiarak tege gida giriu ma kot ma subotlo girin ngara duswiu ngara analyst ma
Atang ara geles yang gire del heart to heart.
Dia ka kayo reg in. Elang lang mo dia ka milil ra imam mru ra cruz na mo dia ka holy water.
Okay.
Na mo dia ka peace be with you na mo dia ka aksyu. Di mesra de Marco.
I see.
Ay la rule ay iglesia at least ta Catholic. And then tial sego ka dir ko man mo.
Ya hak tung se del hak kan dire dia ka haking.
Hak. Di kay kita sa mo man sulang ra teal.
Okay.
Dobante tigal adra ministry ra health.
Okay.
Sulang Dr. Yano saura yan malungil analysis mo task ka. Malungil na kadi analyze advice ka mamamungkin. Tuloy kita Ribka wadi lu lo said reminder other gila Facebook page la Palau Prevention Unit ma guidance center kukul tiri other ngwade ngwa on kotong takal sa sorry confident mo dudura adan si hindi mo sa Facebook page la Prevention Unit ma Palau Community Guidance Center ngara Facebook. Adi kita tuloy unless ngani questions.
Mal.
Malungi la timing makatuwa tagipil early.
I see.
Ibok post tegi del question ra المرة الأدرى بلول hopefully تلوريك سل educational segment
I see.
الجيرة la new normal تيجي the question أصل هي a caller مس كده example ترى a preventive measure ملؤهم تتلي لا pure or something example la new normal during show by ملؤهم تلتاي القرابة اسل الغانير السل بلا إلى التايب السيد الغانسيدر يجيل وسم والأوتيل تيجي the new normal سيجي the question التوليق مسومانيا أرسبيل لهم غضون سيد منجيل التيل مرقوا هو نترا كندل من القرى التقليل the close غما مجي مونير أقول
I see. Okay.
اللي ما لو غبسني اللي تقل بوني تقل يا three little birds تقول على عمل مداملي تقل عبق مالي. Don't worry about a thing, 'cause every little thing is gonna be alright. Singing, don't worry about a thing, 'cause every little thing is gonna be alright. Rise up this morning, smile with the rising sun. Three little birds pitched by my doorstep, singing sweet songs, a melody's pure and true, saying, this is my message to you. Singing, don't worry
Don't worry
about a thing,
about a thing.
'cause every little thing is gonna be alright. Singing, don't worry about a thing, 'cause every little thing is gonna be alright. Don't worry.
tilabran lungil itaklo.
Man simple at all ang sel ending man. Malik mo ikat sa lalo.
I see. Yeah, kung malungil na message. Okay.
Gaya la caller tulig la amla call in don lo correct.
Oh, kasi that's query na back of our
Okay, so sige the example dili caller was sige the borabang gida lo mas.
Oy.
Bank of Hawaii mo sige dia correct answer magidi mo contact ring mo surprise ring.
Okay.
Maman sulang tulig sige dia mo lumang nila talk show gid dal kasus
Okay.
hotline amal mall open MOH hotline of COVID-19 488-0555 at sumo na questions
Okay.
the kasmasum makuk next long edeludio.
Okay. Have a nice weekend.
Next week.
Bye bye.
Thank you.
Bye bye.
Alright.